Hello, everyone. My name is Ivana Castellanos, and I'm a policy analyst at the American Public Health Association Center for Public Health Policy. I'm so excited to welcome you to today's webinar, Protecting Tribal Environmental Health, Challenges and Opportunities for Risk Assessments. This webinar is hosted by the Tribal Public and Environmental Health Think Tank in partnership with the National Tribal Toxics Council, and with support from the Center for Disease Control and Prevention's National Center for Environmental Health and Agency for Toxic Substances and Disease Registry. Next slide. The think tank is a group composed of, previous slide. The think tank is a group composed of community members and professionals with diverse experiences in tribal public and environmental health. The think tank focuses on increasing education and awareness of the unique public and environmental health challenges faced by tribal communities and achieving improvements to these issues. Next slide. The National Tribal Toxics Council is an EPA tribal partnership group focused on providing tribes with an opportunity for greater input on issues related to toxic chemicals and pollution prevention. Before I introduce today's speakers, I want to go over some quick logistics and housekeeping. Closed captioning is available for our webinar. Instructions for accessing closed captioning are in the chat. Today's webinar is being recorded. In the next week, all registrants will receive a follow-up email with a link to the recording, which will eventually be posted on APHA's website. After hearing today's presentations from each of the panelists, we will turn it over for audience questions at the end of the webinar. To submit a question, please enter it into the Q&A function. The chat function is disabled and will only be used for announcements. At the end of the webinar, you will be redirected to a survey. Please take a moment to fill out this 2-minute questionnaire to provide us with feedback on today's event and suggest potential future topics. Next slide. Without further ado, I'm thrilled to introduce today's speakers. First is Diane Barton. Diane Barton is the Water Quality Coordinator at the Columbia River Intertribal Fish Commission, where she provides technical expertise related to water quality, environmental toxics, and regulatory processes. Diane serves as the chairman of the National Tribal Toxics Council, which is an EPA tribal partnership group for the Office of Pollution Prevention and Toxics. Key issues for the National Tribal Toxics Council include advocacy for programs to minimize the disproportionate exposure of tribal members to toxic chemicals, increasing tribal capacity to monitor natural resources for toxic chemicals, and enhancing tribal consultation on chemical risk management and pollution prevention policies. Diane holds a PhD in geochemistry from the University of Arizona and is a member of the Bad River Band of Lake Superior, Chippewa. Next slide. Susan Hansen has over 25 years of experience working on environmental health issues for tribes. She currently works with the Shoshone-Bannock tribes to ensure toxic contaminants are identified and remediated, minimizing exposure to the tribal communities and ecological receptors at the National Priority List Superfund sites. She holds an MS in hazardous waste management, biology and engineering from Idaho State University and has completed postgraduate studies in toxicology and risk assessment. Next slide. Ms. Lori Suter has been employed with the Tohono O'odham Nation as the Mineral Resources Administrator since 2014, with extensive career experience including environmental assessments, laboratory analysis, minerals exploration, and reclamation activities covering 2 active copper mines, 90 private claims, and hundreds of abandoned mine sites. Next slide. Lynn Zender is a recognized expert with over 25 years of experience in tribal environmental health issues related to solid waste management. She is currently director of an Alaska NGO that she founded that provides extensive technical assistance and job training to Alaska Native villages throughout the state. In bolstering program capacity related to waste and water quality, she works with various organizations and agencies, tribal consortia, and universities at the state, national, and international level in developing solutions for islanded, small, and indigenous community waste challenges. In addition, she assists the National Tribal Toxics Council with coordinative tasks as part of the council's work in elevating tribal risk assessment as a perfunctory consideration in any risk assessment effort. As you can tell, we are very lucky to have such a distinguished and knowledgeable group of presenters today. So I'll go ahead and turn it over to Diane to get us started.
Thanks, Ivana, for that welcome. The first slide, please. And I just wanted to, before we start, thank the Tribal Think Tank for inviting the National Tribal Toxics Council to present information to you on how chemical contaminants impact tribal health. Next slide, please. As Ivana said, the National Tribal Toxics Council is a partnership group with EPA's Office of Pollution Prevention and Toxics. We were formed in 2012. And I just wanted to let you know a little bit about OPPT, as we call it. They manage programs under the Toxic Substances Control Act, called TSCA, and the Pollution Prevention Act. Under these laws, EPA's mission is to evaluate new and existing chemicals and their risks, and to prevent or reduce pollution. Part of these assessments include evaluations to human health from chemicals and commerce. Our council interacts with EPA on tribal issues, and we work to ensure that risks to tribes from toxic chemicals are accurately characterized for tribal lifeways, and that these are evaluated appropriately and minimized when needed. We currently have members from tribes across the United States on the council. Next slide, please. The outline of today's talk is going to start with me. I'm going to just introduce you to the 2016 reauthorization of TSCA and how it has become a cornerstone for the protection of environmental justice communities. Susan Hansen is going to come up next and talk about how EPA has conducted risk evaluations through the new TSCA. Then Lori Suter is going to share how tribes are uniquely exposed through their cultural practices. And finally, Lynn Zender is going to address health disparities in tribal health and tribal housing. Next slide, please. TSCA was passed by Congress in 1976. Next slide, please. Thank you. TSCA mandates EPA to protect the public from unreasonable risk of injury to health by regulating chemicals in commerce. If an unreasonable risk is found, EPA must act to reduce it. Before it was reauthorized in 2016, many in the environmental community would consider TSCA to be a failure. Over 62,000 chemicals were grandfathered into use without any review of their safety. 84,000 chemicals currently exist in the inventory. In all that time, only 5 chemicals from the existing inventory were banned for having unreasonable risk to human health, despite different attitudes toward this and different protections at the global level. And to make note of a current issue in the news, TSCA has allowed over 600 new short-chained PFAS into commerce. In addition, risk evaluations under the old TSCA were used a central tendency exposure evaluation. And as you know, probably know, fish consumption is a major exposure pathway for environmental contaminants. Tribes that have treaty-protected rights to fish were unconsidered in any evaluations under the old TSCA. Next slide. But then, June 22nd, 2016, you health professionals, environmental lawyers, and others that care about the impact of chemicals in the environment on human health need to take notice of this reauthorization. The authority to protect potentially exposed and susceptible populations is now codified into law. In addition, the law mandates a safety review of all chemicals in commerce. It has removed the cost-benefit standard for risk evaluations. The downside, though, now is that it preempts state authority to restrict the use of chemicals, and which you might see in the states of California, Washington, Minnesota in particular. So next slide, please. Susan Hansen next is going to talk about how risk evaluations have been conducted under the new TSCA.
Thank you, Diane. TSCA risk evaluations include a number of steps, including prioritizing the chemicals, evaluating the risks, whether or not they're unreasonable or if there's no unreasonable risk, and then of course risk management, which would impose restrictions to eliminate unreasonable risks. The new amended TSCA had specific language to talk about the chemical substances or significant new uses of chemical substances that may present an unreasonable risk of injury to health or the environment without consideration of cost. an unreasonable risk to a potentially exposed or susceptible subpopulation. And this is very important for tribes because for environmental contaminants, tribes represent a potentially exposed and susceptible subpopulation. Next slide, please. One of the components of the risk evaluation is a conceptual site model that describes the relationship between the chemical under certain conditions of use and humans in the environment. This is a pictorial version of a conceptual site model for Native Americans. It shows a lot of resources that are used, and it's important to realize that the resources are varied and not linked to a home address. There's montane, forest, riparian, wetlands, desert, and marine resources. You have potential exposures from industrial emissions that go to the air, go to the groundwater, go to the surface water, and those in turn can cause tribal members to be exposed through sweat lodge ceremonies, through consuming game meat that has been drinking from contaminated surface waters or contaminated vegetation grown in the soils. Irrigation water that is potentially contaminated is used to irrigate gardens. There's direct soil exposures, aquatic foods that Native Americans consume, reptiles, fish and shellfish, harvesting, processing, sediment exposure when tribal members are practicing their cultural ceremonies or making pottery, gathering food. We have spring and groundwater contamination, along with non-standard housing, seasonal camping, smoke inhalation, air and dust inhalation. Again, this is just a pictorial of some of the cultural activities that can increase both direct and indirect exposures. Next slide, please. The conceptual site model, again, is part of the risk evaluation that describes the conditions of use. And conditions of use are circumstances as described, as determined by the EPA administrator of chemicals that are the intended, known, reasonably foreseen to be manufactured, processed, distributed in commerce, used, or disposed of. And the working conceptual site model here is one that was developed by the National Tribal Toxics Council to provide examples of tribal lifeways and exposure scenarios and geographic characteristics that EPA really needs to consider in their risk evaluation. Just an example, I'll just name a few of these things: building and carving canoes, lodges and other structures, traditional medicines, creating and using traditional ceremonial clothing, cultural practices such as smudging and ceremonial uses of fire and smoke, use of plants to not only produce the smoke for the lodges, but also for consumption for medicines, and also untreated surface water and groundwater. These tribal lifeways lead to additional exposures for both adult and children from contaminated soils, contaminated air, contaminated water, and commercial products. And these exposures are through all media: ingestion, inhalation, adsorption, dermal exposures. And then, not to forget or leave out the geographic, economic, and characteristics of many tribal housing, waste management issues, such as unlined landfills and sewage lagoons, untreated wastewaters, open burning, Transportation issues, especially in Alaska, ATVs and open air vehicles, snowmobiles, small airplanes, all lead to increased exposures. Next slide, please. So when EPA was conducting their risk evaluation for one of the first 10 chemicals that was to be evaluated under TSCA, HBCD, which is a cyclic aliphatic bromide cluster. That's a mouthful for me. HBCD is a flame retardant. It's used in building materials, insulation, recycled plastics, and solder pastes. And in evaluating the conditions of use, EPA found that 6 of the 12 conditions of use represented an unreasonable risk, even without their looking at all of the scenarios. EPA left out legacy products that should have been considered in the evaluation. They didn't consider groundwater. The consumption rates, it's not clear whether they reflected recreation or subsistence. They use central tendency, which is the median of all the population, and not clear whether or not it's a sensitive population or not. There was only releases to aquatic biota from current uses. And a large one, especially in the Alaska area, is burning of construction wastes that was not considered. The conceptual model presents the exposure pathways. And again, there's many issues with this because there's so many things that weren't considered that are very important to exposures for Native American populations. Next slide, please. EPA, their 2010 action plan, so since 2010, has known that HBCD has been detected in human fat tissues, milk, and blood, and has determined that the general population exposure to HBCD is likely from its presence in food, but also in outdoor air, particularly near point sources. And it's also was known in 2010 that it was detected in indoor air dust. Next slide, please. Fish consumption for the HBCD. Again, EPA used the central tendency for fish consumption. Back, please. Landfills and transfer stations were not considered, and the releases from the burning were not considered. And when EPA determined in their HBCD risk assessment, they said the risk estimates for chronic exposure scenarios may therefore underestimate risks to populations, but it's also uncertain whether any of those subpopulations with significantly elevated fish ingestion rates actually live nearby an HBC facility. In Alaska, there is a lot of open burning that does include some of these materials that could lead to elevated exposure from HBCD. Next slide, please. Tribes consume much more fish than the general US population, and thus have much higher exposure to contaminants in fish than the general US population. Native Americans' fish consumption rates, I wanted just to show you a visual of what these grams and ounces are that are being used to make regulations. The 6.5 grams per day was a fish consumption rate used in EPA's 1980 toxics rule based on 1 7-ounce fish meal per month. That's also an equivalent to 0.23 ounces. The 22 grams per day, which isn't on here and not pictured, is the fish consumption rate currently used to set the general population ambient water quality criteria. 175 grams is a fish consumption rate that's currently used to set Washington and Oregon's water quality criteria. The general US population views 8 ounces, which is the picture on the right, as a standard serving size of fish. And finally, here on the far right is a photo of salmon being prepared for tribal gatherings. And again, Native Americans, children and adults consume much more fish than the general US population. Next slide, please. Here's a comparison of the total seafood consumption rate for the US general population versus Oregon, Washington, and the Idaho, Idaho Native American populations. I think the take-home message here is that this is the most susceptible population. It's the most sensitive of the sensitive populations, and Series 1 and Series 2 are the 50 percentile and the 90th percentile. And really what this is showing is there's a doubling of exposures between Native Americans and the US general population. Next slide, please. The National Tribal Toxics Council really thinks EPA cross-office coordination on susceptible subpopulations is needed. There's a lot of risk assessments being done across EPA in CERCLA areas, with United States Forest Services taking on the lead in a lot of Superfund cleanups, and risk assessments are done, and Native Americans have hunting, fishing, and treaty rights in a lot of these areas. And coordination is really needed across all these offices. Just as a reminder, if it's disposed, it's going to enter the environment. And if it enters the environment, tribal populations will be most exposed in multiple unique ways. And the link between ecological risk and human health risk is key. Next slide, please. Here's some examples of exposures that need to be considered in the TSCA risk evaluations. Untreated water for ceremonies, drinking, and bathing is a real exposure scenario that puts many tribal members at increased risks. Actually, all of these are. Traditional diets, wide range of foods that aren't considered, substandard housing, old appliances. Native Americans spend a lot of time outside activities that use resources gathered from the outside: basketry, pottery making, hunting, fishing, gathering, to name a few. Next slide, please. Here are some more examples of exposures that need to be considered. In Alaska, there's a lot of older engines, older vacuum cleaners, poor ventilation, exposed insulation. Year-round reliance on ATV, snow machines, and inhalation of these emissions. They have restricted access to grocery stores. Many reservation homes are unplumbed and have less access to hand washing. There's full body immersions in surface waters, also steam baths for some of their ceremonial use. These exposures are lifetime. They're not a 10-year or 20-year. They are the entire lifetime of the population. Next slide, please. And just finally, if tribal lifeways and the resulting exposures are not considered, then EPA evaluations and assessments are inaccurate, and they're not protective of this susceptible subpopulation. Tribal lifeways lead to a greater exposure to environmental contaminants because they have an increased duration, higher frequency, and multiple exposure routes. The disposal, end of life of these products need to be considered and present a greater risk, as do legacy use of these materials. And there's many disparities, substandard housing and facilities that lead to greater exposures and impacts. And Lori Suter is going to talk about some of these disparities.
First slide, please. Thank you. According to the 2020 U.S. Census Bureau, the current total population of Native Americans in the United States is 6.79 million, which is about 2%, a little over 2% of the entire population of the United States. 15 states have Native American populations of over 100,000. Reservation life is not just for 15 years, which is the approximate average American population statistic for residing in one place, but for an entire lifetime. American Indians and Alaska Natives born today have a life expectancy of approximately 73 years, which is 5.5 years less than the US population for all races, life expectancy. There is a rational connection between tribal lifeways and health disparities among fence-life tribal communities impacted by chemicals, which needs to be considered in all risk assessments. The National Tribal Toxics Council emphasizes the importance for scientists to consider tribal lifeway impacts when conducting risk assessments and to have a multi-dimensional communication with all affected communities, especially tribal. Next, please. Within the United States, there are 574 federally recognized sovereign nations which own or manage over 95 million acres of land, and about 2 million of those are currently still in mineral leases. This represents a huge diversity of ecosystem environments, from Southwest deserts to the Alaskan Arctic, and from the Pacific to the Atlantic Oceans, from sea to shining seas. Tribes and tribal lifeways are very unique. However, the nearly 7 million Native Americans have something in common. American Indians and Alaska Natives have an intricate relationship and reliance upon natural resources to maintain traditional cultural customs, activities, and traditional diets, and they are a susceptible subpopulation. Thus, there is a need to prioritize tribal exposure and toxicity relationships in order to improve assessment results for everyone. Next slide, please. A picture is worth 1,000 words. The following slides tell a story depicting unique activities and foods from various tribal regions throughout the United States. The increased emphasis on Native traditional lifeways equals the potential for much higher exposure risk to chemicals than that of the general population exposure risk. All ages, and especially the children and the elderly, engage in traditional cultural practices, including gathering and feast activities. Tribal lifeways may lead to exacerbated, ill-defined health risks. Next slide, please. Unique tribal diets may alter exposure factors. Muktuk is a traditional Eskimo dish shown here in the right-hand corner. It's made from frozen whale skin and blubber, which is traditionally thinly sliced, sprinkled with salt, and consumed raw. According to some studies, flame retardants, including HBCD, can accumulate in marine mammals' blubber. Next slide, please. Native tribal lands are subjected to disproportionate amounts of hazardous chemicals associated with industrial activities and mining activities. Near Elwha tribal lands, Puget Sound includes a Superfund site. Regional health risks include people ingesting or touching contaminants in soil, groundwater, sediment, and fish and shellfish. Accordingly, the local wildlife may also be at risk. Next slide, please. Southwestern tribes, including the Tohono O'odham Nation, for whom I work, consume a lot of different local foods. And in this case, it includes mesquite, some cactus fruits, but also the three sisters of corn, beans, and squash. Traditionally, also there's ranching and agricultural careers, as well as the mining activities associated with the Cypress Tohono mine and the mission mines on the Tohono O'odham Nation. However, all tribal people are tied to their communities. Water, air, land, and local foods, supplies for medicine, weaving, basketry, pottery, jewelry, and other cultural products are derived and gathered from local natural sources. Next slide, please. The making of Oklahoma Cherokee traditional hickory nut soup is depicted in this slide, and it includes the grinding activities after collecting. However, I do want to point out that a former lead and zinc mining area, this region includes thousands of acres of impacts to over 7 tribal nations located in the areas of Kansas, Oklahoma, and Missouri. This is the Tar Creek Superfund site, and it impacts Quapaw, Peoria, Modoc, Wyandotte, Seneca, Kayak, Shawnee, the Ottawa, Miami, and Cherokee. Next slide, please. Alaskan Natives widely practice traditional gathering activities. Children are taught by their elders. Next slide, please. Folks considered general population rarely harvest their own berries that they eat. Generally, we purchase them from a grocery store. Gathering is a multi-generational activity. Next slide, please. I really like this slide because it shows how some local resources are being used for both food preparation and for preservation techniques, as well as the occupation of fishing in Alaska. Next, please. Chemicals of concern have been detected in eggs, feathers, and tissues of some geese. There is a great deal of need to improve risk assessments by inclusion of tribal susceptible subpopulation evaluations across all federal risk assessments, and especially in the TASCA program. Next, please. The Yurok Tribe of California retains Aboriginal and sovereign rights to continue forever tribal traditions of, among other things, stewardship of lands, waters, and other naturally occurring endowments within the jurisdiction of the Yurok tribe, while honoring creator, ancestors, and descendants, 7 generations. Next, please. Adult lamprey eels are said to be very edible and taste like squid and are a French delicacy. However, I'd venture to say that eel is not an American staple general population food found in virtually any chain grocery store anywhere. Next, please. And now we're off to Maine. Like other tribes, the Micmac produce a variety of traditional baskets made of ash, birch bark, and cedar. A few varieties of ferns also yield edible fiddleheads foraged from the wild, which are considered a culinary gourmet delight. Next, please. Wild rice grows naturally in northern Minnesota and is hand harvested by tribal members. Minnesota I can't even say that one. Minnesota has one of the largest cluster of iron mines, and their byproducts of mining have been deposited in the lakes where the wild rice grows for quite some time. Wild rice is a food of great historical, spiritual, and cultural importance. Also, an oil pipeline project is slated to cross wild rice habitat. Michigan also is considering renewed interest in copper mining. Next slide, please. So this brings us to our video depiction of the exceedingly close proximity in Alaska Native villages, as well as their schools, their sources of drinking water, and the air quality, which are associated with legally allowed unlined landfills. Illegal dumping, unclosed landfills, and open burning are found throughout rural America and do impact tribal lands. A quick disclaimer, the technology in the video is another example of tribal disparities. The National Tribal Toxics Council apologizes that all of the conversations may be fully understood. Please bear with it. Video clips were taped at various tribal meetings in rural Alaska without expensive recording equipment, and therefore the audio quality is at times not ideal. And after the video, Lynn Zinder will be presenting.
Makol renag ni tonga, makol renag ni tonga, maruch bagal renag ni zgoch tonga kwe, oh, oh, waye ya ye ya nakin panga.
How far is the landfill? I know it's not the scale, but how far is the landfill from the river?
Landfill was directly across from the school. They light the landfill on fire. Sometimes the smoke blows it directly into the school, and it's terrifying.
Landfill site is less than 1,000 feet from our school. So we have kind of a strict policy. When the wind's blowing from the east, we're not burning the garbage.
While we're burning trash and when the wind direction changed, where the family were working on their dry food for the winter, when we get ready to eat it, they called us and they said we affected their food.
Near the uncontrolled fire, the emergency response, there was no emergency response protocol. Got pretty uncontrolled real fast, and it was trying to count the adults. There was me, Thomas, and we had a bunch of children.
They came from Windsor Village and our dump site. Underground water there where the river flows right through. And when we were building these houses, we were building a foundation and we were working in one. The next morning the other one will be full of water.
Go fishing, kids go back there and they fish and they fish good and it's good fishing back there.
Sewage from the public buildings, they went out down to the beach here on the ocean. Because in the summer, we get a lot of kids swimming on the water, and that's getting out.
Some people have water from the river and collect rainwater with their bucket.
Where's the guy's old bell?
It's in the river.
And think about it in fall time, when the high water rises, I'm sure it's pretty much that in the pot water. I mean,
the climate change will have a big effect on the hazardous material waste in our landfill. We really sort on, getting the hazardous material out of our community.
Do they supply with like equipment?
they don't supply us with equipment, we work with what we have.
We have an open access dump. Everyone goes and they dump when they want, burn when they want. We don't really we don't have a collection of hazardous waste material because there is no backhaul program available. So for us right now, there's really no reason to put it anywhere because we have no place to store it. If we just start storing it without anyone able to take it out of there, it's gonna end up being the same way. So for now, everyone just figures a better place for it to be is at our landfill.
Makol renag ni tonga, makol renag ni tonga, maruch pagal renag ni sgoch tonga kwi. Waye ya ha ye he ya nakin panga ayaha makoranag ni tonga marok pagal.
Always look ahead in order to get what we need.
Okay, back to the slide. So next slide, please. And next slide. All right, from a health lens, tribes are very different from the general population. Indian country is more likely to suffer from certain health conditions and more likely to get sicker, have serious complications, and die from them. This graphic is from Families USA 2018 using CDC data. Next slide. Some of the leading diseases of concern are heart disease, cancer, diabetes, and liver disease. The table on the right displays a portion of total deaths for tribes compared to non-Hispanic whites, which are 2 and 3 times higher for diabetes and liver disease, respectively. Next slide, please. Given each tribe has a different culture, geography, government, and more, the size of disparities varies and for different diseases. This graph shows the incidence by IHS region of new stomach cancers for tribal, blue bar, and white non-Hispanics, purple bar, living on tribal lands or counties sharing a boundary. The tribal population as a whole is twice as likely to die from the disease as non-Hispanic whites. Infection with Helicobacter pylori is a primary identified cause of gastric cancer. It's thought to spread through contaminated food and water and direct mouth-to-mouth contact. Worldwide, the infection is associated with people living in crowded conditions and in areas with poor sanitation. And a 2018 study in Alaska, where tribal communities have an infection rate as high as 75%, supports those findings. Next slide. The difference in tribal health from the non-Hispanic white population are not magical. We're using the term health disparities here, the result of systematic greater social or economic obstacles to health, historically linked to discrimination or exclusions. And tribes had and have both. Next slide, please. For example, poverty is associated with hypertension, itself a serious medical condition that significantly increases the risks of heart, brain, kidney, and other diseases. Like many social determinants, this graph shows that while poverty is highest for Native Americans in tribal areas, top bar, and decreases overall further from tribal lands, the disparity with the general population, which is the lowest bar, persists. Next slide, please. In speaking about health and tribes, it would be inappropriate to not mention the state-sanctioned atrocities, genocide, forced relocation, separation of families from their children, and more. This federal Indian policy over centuries largely led to the adverse social and built environmental outcomes that we'll cover next. But historical trauma has its own place in health disparity because while its impact varies among individuals and tribes, the trauma itself is largely present now, as well documented by those who experience it and by scholars and physicians, both tribal and non-tribal. Next slide, please. Because of this, any chemical contaminating tribal lands can potentially act as a chemical mixture of greater potency than the original. Chronic stress, for example, is linked to inflammation and the 6 leading causes of death. While quantitative methods to account for this dynamic may be still in the future, including tribes as Itasca potentially exposed subpopulation now, can allow for a qualitative consideration of this dynamic in the meantime. Next slide, please. So what are these social and economic obstacles linked to health? There's an extensive list of evidence-based associated indicators and their measures broken into 5 main categories by the Office of Disease Prevention and Health Promotion. Next slide, please. And here's a partial list. For example, low socioeconomic status, bolded here, is associated with an increased risk for many diseases, including cardiovascular, diabetes, chronic respiratory diseases, and cervical cancer, as well as for frequent mental distress. Next slide, please. And as examples in this slide indicate, there are disparities between tribal peoples and the general population in every category and most determinants. Social capital for the US overall was actually evaluated by Congress in a 2018 report, and it was telling. For example, out of the 179 counties in the Northwest, just 4 were in the bottom tier, and each was majority tribal. Next slide, please. Now we get into the built environment. According to NCAI, 40% of on-reservation housing is considered substandard, compared to 6% outside of Indian country. And that can link to health in numerous ways. For example, plumbing is associated with lower respiratory diseases, and mold can trigger asthma. Cold indoor conditions have been associated with poorer health and increased risk of cardiovascular disease. Extreme temperatures have been associated with increased mortality. Next slide, please. This chart shows the differences for tribes, orange bars, and white non-Hispanic, blue bars. The left set is the number of households with garages, and the right set is a difference in the amount of home improvement, repairs, and renovations spent annually. Both are surrogate indicators of potentially greater toxic exposures. First, garages. Living in rural areas, DIY home and vehicle care products are common, and without garages tend to be stored in-house, Arctic entryways, or yards, where children can access them. Then disrepaired housing. It can lead to direct exposure to hazardous substances in panels, wiring, insulation, as you saw in the video, and lead-based paint and asbestos in older homes. Next slide. As a surrogate indicator of older household furnishings, the data in this graph indicate that Native Americans, which are the second green and blue bar from the right, are far less likely to purchase or spend money on furniture and slightly less likely to spend money on non-durables. So how does this work? In general, older furniture has greater and longer duration releases, resulting from greater and longer wear and tear of the product, leading to chemical entrainment and to greater amounts of dirt and dust created. For example, particularly before 2013, older furnishings can contain bioaccumulative flame retardants, like as we stated in the video for HBCD, which is found in polyurethane foam cushions, pillows, and mattresses. So tribal people are potentially exposed then to greater indoor releases on top of their greater exposures outdoors. As another example, asbestos in older furnaces, chimneys, and wood heating stoves can become friable over time, presenting higher exposures. Next slide, please. That's legacy use. It's an environmental justice issue, and it needs to be included in TSCA risk assessments. Tribes may have higher exposure to legacy products inside their homes and less protective disposal options for those products when spent. Next slide, please. And if If TSC is to be protective of the population's health, it must evaluate the bulk of exposures. And for tribes who have the potential for multiple high duration exposures through their extensive lifeway interactions with local environmental media and throughout their lifetime, disposal must be treated like the condition of use it is, because that's the primary mechanism by which product releases enter the environment in rural areas. With sites generally more accessible, tribes as a whole are fence-line communities, and the blanket reliance on federal environmental statutes like RCRA to be protective needs to be replaced with a more nuanced look at statute exceptions and regulatory design criteria. Next slide, please. So looking at the asbestos risk evaluation as an example, relating to food security, replacement of certain gaskets for snow machines were left unassessed rather than extrapolated. Tribes in colder states use snowmobiles, not for occasional recreation, but for hunting, food, and regular transportation, as we said. Snowmobiles are the cars in most Alaska villages, and gasket replacement is highly likely to be DIY. Next, health. Asbestos exposure was not treated as a risk factor for stomach cancer, but tribal people are 2 times more likely to die from stomach cancer, and multiple peer-reviewed studies support a moderate risk. Next, socioeconomic status. Tribes are more likely to have older disrepaired furnaces and wood stoves, and thus are more likely to be exposed to friable asbestos. But legacy use was left out and will be addressed in a later evaluation. In the built environment, most consumer products end up in rural tribal transfer stations, C&D, and disposal sites, lacking many protective safeguards. But legacy product disposal wasn't assessed. Last, culture may be impacted with chemical release into the natural environment. You can't quantify what that means, but as the previous speakers explained, the number of activities weaving together for just one tribe are quite high. For example, in a study with the Dene after the Gold King mine spill, 43 separate traditional and customary activities related to the use of water were identified. Current TSC risk evaluations would capture just one of these, the higher fish consumption rates. Without separate treatment as a pest, making significant progress in modeling tribal risk may be impossible. And then next slide, please. Finally, a problem with using the social determinants for measuring health is that they still bring a cultural bias. It's still a set of separate categories important to the general population, but possibly not to tribes or not in the same context or relationship. For example, residential crowding has been linked both with physical illness such as tuberculosis and respiratory infections, and with psychological distress among both adults and children. But it's also for tribal populations a display of strong familial and community values in spite of everything. Homelessness becomes overcrowding, a true resiliency. We're not advocating for overcrowded housing, but to recognize the protective health benefit of a caring community and its solution. Next slide. Jamie Donatuto with the Swinomes tribe ran into this issue when expressing potential tribal health impacts in terms of theoretical cancer and non-cancer risks. Her Senate was at a loss to understand what that meant for the health of their community. Next slide, please. So she and her colleagues have been working on identifying Indigenous health indicators, not just the cancer and non-cancer health risks. These factors include self-determination, education, resilience, cultural use, resource quality, and community connection. A model like this may best measure tribal health because it captures the protective benefits of living a tribal lifeway. The state of the art for risk assessment science may not be there yet, but reframing of what health is can reveal and correct biases in the decisions made for what to include and what to exclude in the evaluation, what uncertainties to assign, and what level of modeling effort is worthwhile. And I'll turn it over now for questions. Thank you.
Thank you, Lynn, and thank you to the rest of our panelists for these wonderful presentations. And if I could ask the presenters to please join me, we'll now be moving into a very brief Q&A with some of your questions. And so if you do have a question, you can submit it by entering it into the Q&A function, and we'll try to get through at least a few before we have to sign off. And so the first question is, so each tribal community is unique and has its own subsistence and cultural practices. Can the panelists speak to or suggest good sources regarding exposure factors for risk assessments regarding tribal traditional lifeways, in specific publications, and they mentioned Harper et al. 2015 and Irvine et al. 2014 often being cited, but I'm kind of speaking to the exposure factors for risk assessments for tribal lifeways.
Ivana, this is Susan Hanson. I can speak for the Shoshone-Bannock tribes have cleanup standards that talk about how certain plants are used and their soil cleanup standards. With this, I would say, you know, each specific tribe may have their own documentation. So I would suggest doing a search on that specific tribe's webpage.
If we don't have any other responses, I can move on to the next question. Did anyone else want to weigh in?
I was going to add too that there is a tremendous literature on tribal foods that gets quite extensive. And if you look at the Lifeline group, was funded actually even by the EPA to go into quite detail for a number of bioregions in Alaska and Southwest, near I think the Great Lakes and the border areas that looks at consumption and contact and different types of preparation, et cetera.
This is Lori Suter, and I always do these researches on the internet and come up with, oh my gosh, I think the most recent one on tribal lifeways had like, oh, I've got it laying here. I think it was 70 or 80 different references available on tribal lifeways. The other thing I found is an EPA document about STAR grants that are an EPA-based thing from 2013. So there's been a lot of research done, and I don't know that it always ends up in the proper handbooks for risk assessors to be able to easily pull up and utilize.
Great, thank you. The next question is really focused around community engagement and community education. So are there any strategies to engage community members in the risk assessment process, and how can the findings of a completed risk assessment be made more accessible to the community?
Ivana, I will say I think engagement with the community is essential, and it needs to be done early and often. And if it's to be with a government-to-government consultation with the business council or the board that directs the tribal community, that is where they could start, or with the public relations in each individual community. But again, it is critical that it happens early before decisions are made.
Ivana, I'd like to add that in responding to EPA on the risk evaluations, please check out our website, tribaltoxics.org. We typically provide template letters for tribal leadership to submit that they can follow and cite the important issues for their own communities. But I think it's an important, EPA is open to this through tribal consultation, and it's a good place to look if you're not familiar with all these technical terms on the individual chemicals.
Risk assessments on mining lands are public documents, so it may take a little bit of extra research on any individual's part, but you can find risk assessments based upon, you know, any mining site in the United States.
Thank you. I wish I could ask any more questions. I know we have a few, but I know we could keep discussing these topics for hours, but it looks like we are out of time for today. So thank you so much to our panelists today for the rich presentations, and thank you everyone for joining us. We will soon be sending all of the attendees and registrants a follow-up email, probably around next week, with the link to a recording of today's webinar. And we also ask you that you please fill out a brief survey to provide us with feedback on today's events and suggest future topics. This concludes the webinar. Thank you.
Thank you.